Pretty excited. We have a new initiative going into our electronic medical record. What we're going to be doing is asking our patients to tell us what their sexual orientation and what their gender identity is, so that can go into the electronic medical record. We recognize that there are very serious health disparities at really devastating levels that hit the LGBT population nationally. I think part of that occurs because people don't know what the sexual orientation and gender identity of their patients are. So our goal here is to help work on reducing these health disparities by getting that information out there so that the provider knows the patient better and can provide better care to the patient.
Well, I feel pretty strongly that it's going to help me take better care of patients. I think that sexual orientation and gender identity are really important to people's health and also to the health care that they receive. And for example, I think a lot of us can make assumptions about people if we don't know what their sexual orientation or gender identity are. And for me, having that information available in the EMR will allow me to enter relationships with patients that are better, and so that I can communicate with them better about what their health needs are and what the risks that they may face are, so that we can really help them take good care of themselves and we can do all the appropriate screening and that sort of thing.
We've started doing grand rounds, going to different departments, having discussions about why this is important and how the information will be used, and trying to give some information on how best to bridge the conversation. We're developing resource information that'll be on our website so that if a physician does not feel confident in this area, they'll be able to, in their own privacy and their own time, go onto the website. We're also developing a list of physicians who feel that they're competent to do LGBT healthcare, which will be a resource not only to the patients but also to our colleagues.
It's called the LGBT EMR Task Force, and we started 3 years ago, but we really never did anything with EMR until now. Like, this has always been our goal, was to get these topics, sexual orientation, gender identity, in the EMR to be inclusive in the patient's history. But we had to do so much prep work to get to this point. So it's nice to actually finally be here. It's like we had to learn how to run before we could actually do the marathon. And we've been learning to run for the past 3 years.